The next two tutorials will cover another important set of bones in the axial skeleton, and that is the vertebral column. The vertebral column has several important functions. It provides structural support for the body, supports the weight of the head, houses and protects the spinal cord, provides articulation points for the ribs and the pelvis, and serves as attachment points for many muscles. In the first part of this tutorial, we'll take a look at the 5 regional divisions of the vertebral column, and we'll start at the superior end. So first, there are 7 cervical vertebrae. We call these C1 through C7. And the cervical vertebrae form the bones of the neck. You should be familiar with the specific features of the first 2 cervical vertebrae. So first we have C1, or the atlas, and the atlas is named after the Greek mythologic titan who was ordered by Zeus to hold the heavens on his shoulders, much like the atlas vertebrae holds the skull, or holds up the skull. The atlas articulates superiorly with the occipital condyles on the occipital bone of the skull. And next we have C2, or the axis. And the axis is named because it is the axis upon which the head rotates. Be sure to look at both the atlas and the axis in the lab, and be familiar with the features of these 2 bones, how they articulate with each other, and how the atlas articulates with the skull, and how their movement is translated into the movement of the head. Next, moving inferiorly, there are 12 thoracic vertebrae, T1 through T12. And the thoracic vertebrae form the upper back, and they articulate with the ribs. Next, we have 5 lumbar vertebrae, L1 through L5. And the lumbar vertebrae form what we call the small of the back. Here's a memorization trick for you when you are studying the number of vertebrae in each region. You can think that you eat breakfast at 7 a.m., lunch at 12 noon, and dinner at 5. If we keep moving inferiorly, we have the sacrum right here. This is the sacrum. And the sacrum is composed of 5 vertebrae, but they fuse into a single bony structure by the time a person reaches about 25 to 30 years old. And it's important to note that the sacrum is the portion of the vertebral column that articulates with the hip bones right here. And finally, we have the coccyx, or the tailbone, which consists of 4 vertebrae that fuse together sometime during puberty. Next, we'll talk about the spinal curvatures that are associated with each region of the vertebral column. The geometry of these curvatures enables the spine to much better support the weight of the body than if it were perfectly straight. And the curvatures line up with the regions we just talked about. So first we have the cervical curvature right here. And next we have the thoracic curvature right here. And then the lumbar curvature here. And finally the sacral curvature right here. The thoracic and the sacral curvatures are also sometimes called accommodation curvatures because they accommodate the thoracic and the abdominal pelvic organs. And then the cervical and lumbar curvatures are sometimes called compensation curvatures because they help to shift the weight of the trunk of the body over the legs. Most of the vertebrae share common structural features, and we'll talk about a few of these. First is the body of the vertebrae. These are on the anterior region, and it's a cylindrical body on the anterior region of each vertebrae. And here's some of them, and here we can see them from the lateral perspective. The intervertebral discs are found between the bodies of adjacent vertebrae, and they both separate and connect the bodies of the vertebrae. These articulations are considered to be cartilaginous symphysis joints. The intervertebral discs allow only slight movements between the adjacent vertebrae, but the collective movement allows for the flexibility of the vertebral column. Most vertebrae also have a posterior projection here called the spinous process, and those line up along the posterior side of the vertebrae. So if you run your hand along your back, you can palpate these spinous processes through the skin of your back. And then two lateral projections, which we can see here and here, and those are called the transverse processes. So I'll highlight both of these. Here we have the spinous process, or the spinous processes. You can see them highlighted in light blue for all the vertebrae. And then the lateral transverse processes, also highlighted in blue. So let's take a quick closer look at these structural features on an individual vertebra. On this isolated thoracic vertebra, first we can see the body right here. And then the posterior spinous process. And then the two lateral transverse processes. And there's the spinous process, posterior. And one last important feature is this structure, which I'm going to highlight, which is called the vertebral foramen. And that's this hole, or this space right here that I'm outlining. The combination of the vertebral foramen of all the vertebrae are what form the canal that houses the spinal cord. This vertebrae that we're looking at is from the thoracic region of the vertebral column. In the lab, in addition to knowing the different regions of the vertebral column and the common structural features of the vertebrae, you should be able to look at an individual vertebra and identify which region it came from by its unique features. In the next tutorial, we'll give you some tips on identifying the different vertebrae by region. And this concludes this tutorial.